that are here today, and as well as all the members. In order to save time, I will ask Minister Anand to, I believe she had some opening remarks for this committee, and I will ask her to get started right now.
Merci beaucoup et bonjour.
Thank you very much. Hello all. Thank you for inviting me. Before I start, I would like to thank the people working behind the scenes to make this meeting possible. Let me also thank our interpreters, who continue to play an exceptional role in ensuring Canadians have the latest information. I'm talking today from Ottawa, which is on the traditional territory of the Algonquin peoples.
With this committee, it is fair to say that the world was a very different place. Since then, we have all seen the impacts of the COVID-19 outbreak. Our daily lives have been disrupted, our economy has faced challenges, and loved ones are falling ill. We know that Canada may be dealing with spikes in infections for months to come. It is clear that we must address our short-term needs and plan for the long term so that we are prepared for all possible scenarios. Through this crisis, our government is committed to doing whatever it takes to keep Canadians safe, protect our economy, and get everyone the help they need. We all appreciate the measures Canadians have taken to curb the spread of the virus, and we are especially proud of the doctors, the nurses, healthcare providers on the front lines. Their work is critical, and that is why my department is so focused on procuring the personal protective equipment that Canadians and those on the front lines need. Nos experts en approvisionnement continuent de s'employer activement jour et nuit à faire ces.
Our procurement experts continue to work day and night aggressively, buying from all available suppliers and distributors.
Operating in a highly competitive global environment. The entire world is seeking out the same materials, be they masks, tests, gloves, gowns, and supply chains are stressed at multiple points. This is resulting in a complex procurement environment where there are many risks. Mr. Chair and Vice Chair, allow me to explain our procurement strategy in this unpredictable setting. The first part is to buy existing inventory immediately at home and around the world to meet our most pressing needs, and we are leaving no stone unturned. The second part of our approach has been to place large, consolidated bulk orders on behalf of provinces and territories. This helps us to attract suppliers in a competitive marketplace and keep a steady stream of goods flowing across our border. Let me take a moment to explain how we are using our online channels to engage suppliers. On March 12th, we sent out a call for companies to help Canada fight the outbreak on our online platform buyandsell.gc.ca. The response has been overwhelming, with more than 26,000 submissions received. I am pleased to say that we have made at least initial contact with all domestic suppliers that have come forward to offer their help. We are aggressively working through submissions, placing priority on the offers for supplies for those most in need and that already meet Health Canada standards. We are also making large international purchases. Our government has called on Canadian companies to ramp up domestic manufacturing. At the same time, companies from across this country have answered the call, and my department is quickly establishing contracts with them. For example, we are finalizing a long-term contract with Medicom out of Montreal to produce tens of millions of N95 respirators and surgical masks annually right here in Canada. We have also established contracts for tens of thousands of ventilators with Thornhill Medical Supplies, CAE, Ventilators for Canadians, Linamar, and Starfish Medical, all Canadian manufacturers. Some Canadian companies are completely retooling their production lines to meet our needs. Companies like Bauer in Quebec has gone from making hockey equipment to making face shields for frontline medical workers, and Stanfields in Nova Scotia is set to provide us with 100,000 medical gowns per week. Irving Oil in New Brunswick is another great example. They've retooled their lines to produce hand sanitizer and will deliver in the coming weeks. These companies demonstrate the Canadian ingenuity and tenacity that will see us through this crisis. While we are focused on buying the most vital supplies, we are also supporting the fight against COVID-19 through other procurements. These include contracts for nursing services, security, cleaning, as well as air charters to repatriate Canadians. There are also contracts for First Nations paramedics and mobilized community shelters, to name a few. Through all of this, we have significantly changed our approach to buying and accelerated the procurement process, especially when it comes to meeting Canada's urgent needs. We are working around the clock to get contracts in place as fast as possible and in an intensely competitive market. La bonne conduite de nos achats.
Underlying our buying efforts is a close collaboration with provinces and territories, as well as domestic industry players. To this end, I have established a federal, provincial, territorial, ministerial trade table to discuss opportunities for collaborating around procurement in the fight against COVID-19.
Had constructive discussions with business leaders in the Canadian medical supplies community so that we can continue to address the most pressing procurement issues and work together on a shared path forward. Let me turn to discuss the international supply chain. While contracts are put in place and domestic production ramps up, we still need to bring in internationally sourced materials, and much of it is coming from China. While we have experienced challenges, we have some successes. We must note that we have a number of planes that have continued to come from China. We have set up a procurement approach to bring in supplies from China to ensure that quality products get here with as little delay as possible. Our government is also working with American officials to ensure that vital supplies continue to flow across our border. I will note that one federally chartered plane returned to Canada without its intended cargo, but I can confirm that those goods have arrived in Canada, and during the same 48-hour period as that flight, 4 other federal planes landed in Canada with cargo, and over 10 planes from China have returned to Canada with supplies overall. It is important to note that in this procurement process, the federal government is not the only party at the table procuring supplies for this country. Provinces and territories, as well as healthcare centers themselves, are securing supplies on their own, and we are collaborating with them to make sure that they have the transportation to bring those shipments home. Une fois que les envois arrivent au Canada, l'Agence de la santé publique.
Once those shipments get to Canada, the Public Health Agency checks the quality of all products, same for products produced in Canada.
Have had some quality issues with supply that have not met our standards set by the Public Health Agency of Canada. Quality issues, while unwelcome, should not be unexpected given the surge in global demand for these goods. I can tell you that while we are buying at a faster pace, our priority remains making sure that we get safe, effective supplies to healthcare providers. After our orders pass inspection, Only then does the Public Health Agency turn their focus to getting supplies to where they are needed across the country. To help us with domestic distribution, we have contracted with Amazon Canada, one of the companies that answered our call to action. Let me be clear about their role. Amazon is currently providing use of their online business platform to help manage the inventory and allow provinces and territories to directly order supplies. Canada Post and Purolator, who are both business partners of Amazon Canada, will handle all warehousing and delivery, and this is all at cost without profit. This agreement is important to ensuring that masks, gloves, and other vital equipment are provided to frontline healthcare workers as quickly as possible. This is truly a Team Canada approach with all hands on deck, and we are making steady progress. Things like surgical and N95 masks are now being delivered and distributed to provinces and territories. On ventilators, deliveries will be rolling out as early as next week. Public Health Agency has already deployed 400 ventilators to the provinces and territories from the National Emergency Stockpile. And when it comes to testing, we have contracts in place for rapid test kits. We will continue to seek out and purchase swabs and reagent required for conventional testing. Reagent is in short supply around the world, and I'm pleased to say that under very difficult conditions, we brought back a shipment of the important base chemical back to Canada. Luminultra, a company in New Brunswick, is now producing reagent with that chemical. So I want to convey to you as a committee that we are taking new steps to be more transparent and to keep Canadians up to date with our work. Today, we are launching an online report detailing the progress that we are making on procuring key COVID-19 supplies. Through all of this, my department continues to deliver its most critical services, like processing payments through the Receiver General and maintaining federal buildings and infrastructure. But our most important task right now is the urgent procurement of vital supplies in the fight against COVID-19. We have significantly shifted our internal resources towards that effort. Before I close, I would like to personally thank everyone at PSPC who are keeping our business going, especially those who are helping to meet Canada's medical supply needs in a difficult and challenging time. We are making real progress, but we must continue to be vigilant, we must be realistic, and we must recognize that these are unprecedented and unpredictable times, including unpredictable markets. I want Canadians to know that we will continue to do whatever it takes to get supplies into the hands of those who need it most as quickly as possible. Merci beaucoup. Thank you for your time. I'm very happy to take your questions.
Thank you, Minister Anand. We will now go to 6 minutes round, and I want to apologize to my Conservative colleagues. I don't know who is up first, but whomever that person is has 6 minutes.
You're doing a great job, Ed. Sorry, go ahead.
If I may, Monsieur Drouin, it will be Mr. Macaulay leading off for the Conservatives, according to the list I have.
Yeah, you're doing a great job filling in, Mr. Drouin. Minister, thanks very much. I appreciate your comments, and I echo your comments about the translators. They're doing a fantastic job in difficult circumstances. Minister, I want to start with a quote from your predecessor, Minister Qualtrough. On April 12th, she said, Canada's strategic stock of PPE was not a priority. I'm wondering if you could explain why.
Well, thank you so much for the question. I will say that the handling of the national stockpile is not within the purview of the PSPC. It is within the purview of the Public Health Agency of Canada. I did hear those comments that my predecessor made, and my focus from day one has been to fulfill the orders that have come in from the Public Health Agency of Canada, which have been given to them from the provinces and territories every single day and night. The team at PSPC has been procuring those orders that have been coming in. So that's the approach we're taking. It's aggressive, it's proactive, and we are really working hard to fulfill provincial and territorial orders.
Great. No, I appreciate that. But again, PSPC does have a major role in maintaining the stock. I look at your departmental plan that you published March 12th. This is your own departmental plan. Not once does it mention, even though this is well past the start of the COVID crisis, there's no mention in your departmental plans about PPE supplies, any priorities around that. I'm just curious why.
Once again, I want to emphasize that the orders that we are placing and the approach we are taking to procurement in very difficult international circumstances characterized by extremely high demand is that we are taking requests from the Public Health Agency of Canada. We are going above and beyond the orders that they are providing to us, but our approach and indeed the questions relating to the National Emergency Stockpile should be directed at Public Health and Health Canada. That is not within our purview.
Is there, because you're the main purchaser, is there not some mechanism where PSPC looks and says, geez, we haven't ordered anything in 6 years, perhaps we need to follow up, or is it just merely passing the buck to another department? And a follow-up question to that is, when did you actually start the purchasing in a major way? The reason I ask is when we started the daily phone calls with health on, I think it was the second week or the first week after we rose from sitting, I asked a question about respirators, and we were told on the call from the department, we're not buying any respirators, we don't need them. The very next week, it was, I think it was March 26th, I asked a question about PPE, and the comment came back. This was from all the government departments sitting around the phone. We're not buying any more PPE, we don't need it. So here we have your predecessor saying buying, like ensuring that the national stockpile is not a priority. It's not listed once in your departmental plans, although I do note stuff that banning plastic straws is a priority, but not the PPE. And then we have the government itself and the conference calls to members of parliament stating almost up to the end of March that respirators and PPE are not needed. When did we decide it was needed? When did we start the major purchasing?
So thank you for the question. I will note there are multiple questions in that intervention, and so I'm going to do my best to respond to them, and I hope you'll allow me the time to do so.
Yeah, I'll repeat them if I don't, or if you need clarification, but go ahead.
Well, I'm just hoping you'll allow me the time to do so. The first question relates to, as you referred to it, as passing the buck. It's quite the contrary. We are engaged in intense cross-government collaboration and cross-provincial and territorial collaboration. From the outset, we've been working directly with provincial and territorial governments to inform our bulk buying approach. In fact, I'm in regular contact with my provincial and territorial counterparts to ensure that we are meeting their needs. I've had a call every 2 weeks with them to ensure that we are meeting their needs.
Minister?
Pardon me?
I'm sorry, can we get to answering the questions, please?
The question related to whether we were passing the buck, and I'm trying to suggest that that's quite the opposite.
Can we move?
It's a collaborative
to the next
approach.
one is when we started the major purchasing.
The second part of your question related to ventilators and the purchases of ventilators, to which I will now turn. And in terms of ventilators, you have to recognize that there is a set of ventilators already in Canada, 5,000 to be exact. That's quoting from our Chief Medical Officer, Dr. Teresa Tam. In addition, we have procured 500 ventilators, which are being distributed out to the provinces. And then on top of that, we are building up domestic supply for 30,000 ventilators from domestic corporations. And so we are purchasing in bulk in addition to the existing stockpile of ventilators. So you have to remember when you're asking about additional purchases, there were in existence ventilators already in Canada.
I'm asking
and
when we started the process of buying more.
Furthermore, if I could continue, the process of purchasing equipment exists not only at the federal level, but provinces and healthcare centers also are buying their own PPE. So getting the information about federal numbers is only part of the story that I am filling in, but the provinces and healthcare centers also tell part of this story, and it's a collaborative approach that we are taking.
Do we have any more time, Mr. Clerk, or?
Unfortunately not.
Yeah.
There's only about 10 seconds left.
Okay.
Thank
Thanks.
you, Mr.
We'll fill in
McCauley.
5 more questions in those 10 seconds.
Thank you. And I'll just remind colleagues to, because we are online and going through video, it's really hard if 2 people are speaking at the same time, especially on a video conference. So if we can let the person finish and or ask the question. And I'll now move on to Mr. Weiler for 6 minutes.
Thank you, Mr. Vice Chair, and good morning, Minister. We really appreciate you taking the time out of what must be incredibly busy days to appear before our committee. I just want to jump right into some questions here. I've been speaking to many business owners and leaders in my community, like John Reichman, who's interested in using his own business, Edge Catering, to supply meals to those in need during this pandemic. Other individuals and businesses are using 3D printers to manufacture face shields and other PPE. Can you describe our government's efforts to support local suppliers or individuals who are helping to address the COVID-19 response?
Thank you so much for the question. I will say that the first effort we did to make sure that we had the ability to reach a broad range of suppliers was to put up a call out to suppliers on the website buyandsell.gc.ca. And as I mentioned, we have received over 26,000 responses from suppliers domestically and internationally. Now, your question related to domestic industry, and I, like you and probably every member of parliament around the table, has heard from people in their ridings who would like to step up. And that's characteristic of the approach that we are seeing from the Buy and Sell website. I want to commend Canadian industry and business alike for stepping up in this way. What we are doing after we receive the supplies offer is to contact each of these people, which we've done, and then we are going ahead and making contracts with some of them. In addition to PSPC's efforts, ISED is leading the plan to mobilize industry to fight COVID-19. And as much as possible, we are trying to secure supplies from Canadian manufacturers so that we can get them into the hands of frontline healthcare workers as soon as possible. Some key examples are companies like Bauer with face shields, Stanfields and medical gowns, Irving Oil hand sanitizer, Medicom on masks, Spartan on test kits, Thornhill Medical on ventilators, and the list goes on. As you can see, we are seeking to ensure that we have multiple supply chains operating at the same time. That means that we want to make sure we have domestic sources of supply as well as international sources of supply, so that we have supply chains operating in tandem, which is a way of not putting all our eggs in one basket, if you will. It's very important to have complementary supply chains, and that's the importance of building up domestic capabilities.
Definitely, no, and I do appreciate that. I don't think any other example underlines the Team Canada approach more than having Bauer producing face shields. But touching on what you're mentioning with Irving, 101 Brewhouse and Distillery, Montes Distilling, Pemberton Distillery, and actually all the distilleries in my riding have shown an amazing ability to adapt their business, keep their staff on, and be able to retool their production to make hand sanitizer that's, of course, in such high demand right now. And I was hoping you could describe the process that they should go through to get approved and to produce hand sanitizer and sell it to the federal government.
Sure. As I've mentioned in my opening remarks, we are using a Team Canada cross-government approach to procurements. And in the first instance, regarding a new business that wants to produce hand sanitizer, for example, ISED has been leading the plan to mobilize industry in the fight against COVID-19 and introducing measures to directly support businesses to rapidly scale up production and retool their manufacturing lines to develop products. Amongst these measures, the Strategic Innovation Fund will deliver direct support to Canadian companies for large-scale projects. The Innovation Solutions Canada project will be helping companies commercialize products more quickly. When businesses are identified by ISED as being equipped to retool and to scale up production, they are supported to ensure that their product will meet the qualifications set by Health Canada. PSPC works directly with ISED to go through a due diligence process leading to a potential contract. So it's a collaborative approach among government departments.
Thank you.
Mr. Wheeler, I apologize for intervening. I've received a message from the interpreters. They're having a lot of difficulty hearing you. Is it possible for you to hold the microphone close to your mouth when you speak?
Sure. Yeah. No, I'm just readjusted here.
We're still having the same issue. Your sound seems to be cutting out. If you could try holding it up, I don't know if that might help. Thank you.
Sure. Okay. Well, I'll try this and see how this works. So I'll just jump into my next question here. So how has public procurement worked to address the backlog of tens of thousands of applications to support the government efforts during this pandemic? And what sort of challenges are you facing in processing those applications?
So as I said, 26,000 plus applications to us and 14,000 domestic submissions has resulted in a large approach being required. So we have taken a centralized approach, which allows us to assess and triage information in a systematic manner. The information that is provided by suppliers is triaged into 4 tiers: companies that are in the medical field, companies in other lines of business relating to goods and services that we're looking to procure, submissions from professional businesses, but not found in databases that we currently have, and submissions that use public domain emails. As I said, we have reached out to every single domestic supplier that has been in touch with us, but the triaging process is still continuing. And I will say that overall, I'm extremely heartened by the level of enthusiasm of Canadian business to step up in the fight against COVID-19.
Monsieur Drouin, juste pour vous avertir que Madame Vignola, c'est la...
Mr. Drouin, Ms. Vignola will be the next member to speak. Thank you. And how is Mr. Chair doing, especially with regard to sound? Should we do a sound test? Ms. Vignola, you have 6 minutes. Thank you very much. Thank you, Minister Anand, for joining us today. I have a few questions. First, Amazon. Amazon is letting us use its online platform. Here's my question. Why isn't Canada Post handling all distribution? Is Canada Post not able to do the same thing that Amazon is doing for us? Thank you for your question. Our priority, our number one priority, is the health and safety of Canadians. That is why we are doing everything we can to ensure that frontline healthcare workers have essential supplies as quickly as possible. As you said, we signed a deal with Amazon Canada, which includes Purolator and Canada Post. And this deal will help us manage the distribution of essential medical supplies purchased by the federal government. There are different roles for each of these partners.
Amazon fait
Amazon has an online platform.
The items that we are going to distribute, and the provinces and territories can then place orders on that platform that are then distributed by Canada Post. Donc, ils ont les rôles différents et Canada Post n'ont pas le...
Canada Post and Amazon Canada have different roles. Okay, I understand that much, but here's my question. Was Canada Post's platform unable to do what Amazon's platform could do? Did we really have to enter into an agreement with a foreign company? What would we have to do for Post Canada to be able to handle all distribution? It's not Amazon. It's not a foreign company. We are working with Amazon Canada. Amazon Canada operates in Canada with, as partners, Canadian businesses. All three of these partners, Post Canada, Amazon Canada, and Purolator, are giving us good service at cost without profit.
Companies. Amazon Canada is a Canadian company. Est-ce qu'il y a quelque chose d'autre?
Do you have any further questions? Well, we've already discussed warehouses that were emptied. Why? Maybe because of some communication mishaps. My question is logistical in nature. So recently, 2 planes left China for Canada completely empty. And we were told that there was a traffic jam near the airport in China. We know that, but here's my question. What is the government currently doing to ensure that that situation does not reoccur? Thank you for your question. That was a difficult situation. It was raining last weekend, and that created additional challenges. We have implemented other means of ensuring that that does not happen again. We are working on ensuring that flights can take off more easily. We have 2 terminals at the airport, one for Cargojet, the other for Air Canada. We are, in fact, diversifying our strategies in China. Moreover, our embassy in China is helping us and working with other businesses who are helping us. Here's an example. Deloitte Canada, another example, Bolloré. These businesses are helping us with supply from China. We have taken action to ensure that this problem will not reoccur.
Colleagues, for just before I go on to Mr. Green, I will keep time and try and show you when you have a minute left. And so you can see it on the screen. Mr. Green, you've got 6 minutes.
Thank you very much. I'm going to pick up where my friend Mr. McCauley left off as it relates to the role of the minister in the National Emergency Supply Stockpile. I'm to understand that the stockpiles have been disposed of in accordance with the Treasury Board directive on the disposal of surplus material. Am I to understand that the disposal of surplus items that would go through the GS surplus porthole would be within our buy and sell framework? Are you aware, or is your ministry involved in selling the surplus items, Honorable?
Sorry, I'm having a hard time understanding the question. Am I in charge of the items that would be disposed in the stockpile? Is that the question?
Correct. Yes.
I am not in charge of expired items. That is within the realm of the Public Health Agency of Canada. And I believe you referred to the Regina stockpile. So I'm wondering if I could just make a comment.
I haven't actually referred to that as of yet. I'm speaking generally. I just wanted to make sure that you are responsible for the selling of these items, not the expired ones, but the selling of the surplus items.
So what I'm responsible for is procuring the items. That's buying the items that come into Canada. Once they come into Canada and they are placed in the warehouse, they are inspected by the Public Health Agency of Canada, and my department does not have a role in that inspection. They are then distributed out to the provinces in accordance with a formula that Health Canada reached with the provinces and territories on the basis of an 80-20 split. Again, that is nothing that I have control over, but I will turn to my Deputy Minister.
Actually,
Bill
that's
Matthews.
fine. I'll accept that because I only have 6 minutes. I just would like to know that, at what point did you know as the minister that they had been disposed? We know that we only found out about this stuff because somebody took a picture of it in Regina who didn't get a contract. There are many other facilities. I'm just wondering that in your conversations, when as a minister did you become aware that our stockpile had been depleted and that critical supplies had been expired and disposed of?
Well, we do run GAC surplus for surplus goods that departments want to get rid of, but we would not sell expired goods.
No, but I think the directive was that you were to have this stuff distributed before they were expired, which is a big part of the problem. Through you, Mr. Chair.
So we don't distribute.
Through you, Mr. Chair, you'll note that at the appropriate time, I do have a motion, and we'll get to that information later on. I want to make sure that we have a chance to talk about our government as an employer, because I think that we have a very important role. And I'll note that there's been some really progressive steps taken to consider things that we call the courage pay or the danger pay, as it were. And there has been an increase in pay for some grocery store workers, and there's talk about hazard pay for healthcare workers. Honorable Minister, you've probably received from SEIU Local 2, the Treasurer Secretary, Tom Gallivan, recognizing that we employ close to 1,000 cleaners in Ottawa alone, and that as a federal body, we have properties all across the country. Has there been consideration for our frontline janitors and cleaners as it relates to providing immediate raises and keeping cleaners employed during this time, as well as ensuring that they're all working safely with the required training and PPEs? How are we taking care of our own staff and employees as employers?
I appreciate the question, and especially the motivation for the question, which is one that I share with you in terms of empathy for those people who are on the front lines. I definitely have that concern in mind too. But in terms of the precise answer to your question, that is an issue that rests with Treasury Board, and so I have been engaged in conversations, but it's not my purview to set those in place. In particular, I will say that I have, as a member of Parliament, not a minister, I have had conversations with unions in my riding who have concerns that you raised.
Well, I do want to make one distinction. I'm not asking for empathy for the janitors. I'm asking for justice for the janitors, which is a little bit different. There have been some conversations, at least in the briefing notes that we have here, around procurement as it relates to different companies that have played key roles, and they've been identified on this call. There's one that I can recall, AMD Medicom, which, according to a media report, the federal government will fund the facility for startup costs. We're hearing a lot about masks and shields, but we know that public health is going in the direction of swabs and testing. There is a company right here in Hamilton called Designated Medical, which has the ability to get in and potentially create 20,000 swabs a day within a week's time. Is the federal government looking at, is your department looking at ways for direct investments in these startups so we can have companies like Designated Medical go online and start with the mass testing, which I think the generally acknowledged principle is that in order to get through this, we're going to have to start doing some mass testing.
So is the question relating to the way in which that corporation or any corporation comes into producing and contracting with the federal government, or is it relating to a particular other issue?
The emphasis has been on swabs
unfortunately,
and masks.
Unfortunately, we're out of time. So
I thought it was a straightforward question.
It is a straightforward question. I would love to answer it if the chair will let me have that time.
I will opt to. I now have to let the official chair take over. I believe Mr. Lukiski is ready to chair this meeting. Welcome. I didn't want to do a coup d'état on you. I just had to take over for a while. Tom, welcome.
Thank you very much, Francis, and thanks for taking over. Can everyone hear me all right? I see nods. Unfortunately, my laptop broke down. That's the cause of the technical difficulties. And as a consequence, I have no headset or microphone. And I'm also somewhat limited by, I'm using a mobile device. And we've got a few issues with that as well. However, we'll muddle on through. Our next speaker, I believe, for 5 minutes will be Mrs. Block. Kelly, you're up. Mrs. Block?
Yes.
There we go.
Thank you very much, Mr. Chair, and thank you very much, Minister Anand and departmental officials for joining us today. I really appreciate the opportunity to ask some questions of you. I also want to say at the front end that I appreciate the briefings that we've been receiving from the parliamentary secretary, albeit we were well into this crisis once they started, but they've been very useful and helpful for those of us who serve on this committee. So I know, Minister Anand, that there have been a number of stories reporting that Canada is building a supply chain in Canada. These stories have highlighted the connections that our current government has in that country. And so I'm wondering if you could answer the following. Who is on the ground, so to speak, or which department is in China overseeing the supply chain and ensuring the supplies get off the ground in China? And given yet another story about 1 million substandard masks arriving here, who is ensuring quality control over this Canadian made in China supply chain?
Minister Anand, I believe your microphone is muted.
I'm going to take that question in two parts. The first relating to on-the-ground operations in China, the second relating to quality control. And the very first point that we have to remember, and we cannot stress this enough, is that it's a highly competitive global environment and international logistics are challenging. We are working very closely with our embassy in China, as well as on-the-ground logistics expertise in the private sector to get supplies into the hands of healthcare workers on the front lines of the crisis. This means that from the point of contracting to the point of arrival in Canada, we have a multi-stage process in place. Our ambassador, Barton, in China and I are in almost daily contact about the situation in China, and in addition, two firms, private firms in Canada, assist us with getting the goods to the warehouse and then through the bureaucratic channels and then on the planes and over to Canada. We are ensuring that we have a diversified source of supply. And when I talk about diversity, I mean diversity of country, of manufacturer, of good, of supplier, and ultimately of air carriers. And the flights that have arrived in Canada have, and this is over 10 flights now from China, have been successfully warehoused, and goods are getting out to Canada, to Canadian healthcare workers. The second part of your question related to quality control, and without question, quality control is a concern for us, and that's why we have quality control occurring in China as well as on the ground in Canada. Once the goods get to Canada, Public Health Agency of Canada has testing measures in place. They're in place for the very purpose of ensuring quality control of essential products so that the equipment that gets sent out is safe for our healthcare workers. We do hold back some supplies that don't meet the medical testing standards, and at PSPC, we're constantly adjusting our procurement approach to mitigate this issue at the outset. This is a key reason why we're continuing to diversify our supplier base so that we're not drawing on one supplier only. Our commitment overall is to supply good product to frontline healthcare workers.
Thank you. I want to follow up that question or that answer with another question. So we have this Canadian made in China supply chain. Are the companies that provided us with these substandard masks continuing to be part of Canada's supply chain? And then I would ask a follow-up question. When the planes arrive in Canada, either full of supplies or empty, who is there to receive them?
Sorry, what was the second question?
The second question was around when the flights, the planes arrive in Canada, whether they have supplies in them or not, who is there to receive them? Who takes ownership of that?
Minister, I'm sorry, we are almost completely out of time. I would ask you that if they're at the end of the meeting or at the end of your appearance before this committee, should there be any questions that you did not have a chance to respond to, if you could provide written answers to those questions through the clerk to the rest of our committee, I would appreciate it greatly. Now we'll go on to Mr. I believe I don't have the list in front of me, but if my memory serves me well, Mr. Kuzmierczuk, you're up for 5 minutes.
Thank you very much, Tom. Appreciate seeing you, and thank you very much, Minister Anand. Thank you for being here, for sharing your time, and also thank you to the officials as well. We know how incredibly busy you are, and all of your efforts are much appreciated. Minister, I had a chance to speak this morning with David Muche, who is the CEO of Windsor Regional Hospital, and he stated that the support from PSPC and from your team has been, quote, outstanding. And that was terrific to hear. I know we're working together to try to secure PPEs for frontline staff in our community from numerous countries. I just wanted to ask you, Minister, if you can sort of describe how does PSPC work with other departments and other governments, if you can sort of delve into that a little bit. Thank you.
Well, thank you for that unexpected comment. I appreciate it. So as you know, we are the central purchaser, and we are spearheading the consolidated purchase of emergency supplies and services required for Canada, including at the federal, provincial, and territorial levels. We are procuring a wide range of emergency supplies and services at the request of the Public Health Agency of Canada, which is spearheading the asks from territorial and provincial partners. But as your comment suggests, that there are also hospital systems that are asking for our assistance, and we are providing transportation services from China for many, many different partners, provinces, territories, hospital systems, conglomerates of healthcare providers, so that we can ensure that our frontline healthcare workers have the supplies they need. It's not a competitive approach as much as it is a collaborative approach among people, partners, organizations, governments in Canada. And we're all focused on the same goal, which is to make sure that frontline healthcare workers and Canada's healthcare professionals have exactly what they need.
Thank you very much, Minister. You know, during the Second World War, the area of Windsor and Detroit was termed the arsenal of democracy, and in a lot of ways, we have become the arsenal of health in Windsor and Detroit and this surrounding areas. And you look at companies like Centerline partnering with St. Clair College to build ambu bags and ventilators. You look at Hiram Walker and Wolfhead Distillery converting some of their operations to hand sanitizers. Of course, Ford Motor Company, Fiat Chrysler, companies like Valiant and Vistaprint building face masks and face shields. I just wanted to ask you, Minister, how would you, in terms of what do you think is the Canadian capacity to address the demand for PPEs?
You will have seen in the various releases from our government and in the press that Canadian industry has stepped up in a big way to rapidly scale up and retool production capacity, as your question suggests. With ISED, we are working very hard to make sure that contracts are in place for the retooling of Canadian industry. Amongst these measures, the Strategic Innovation Fund will direct support to Canadian companies for large-scale products, and Innovative Solutions Canada will be helping companies to commercialize products more quickly. You listed a bunch of companies, and I have previously, so I won't do that again, but I will say that we are pursuing every possible avenue to secure life-saving equipment and supplies that Canada needs from a diverse range of suppliers, both domestically and internationally. And I will say that on the distribution of supplies, whether they are Canadian or international, they all have to meet PHAC specs. And only then, after they have done that, are they distributed by Amazon, Amazon Canada, which is not a Canadian company, but the fact that it has operations and workforce in Canada, partnering with Purolator and Canada Post to make sure that our frontline healthcare workers get the supplies they need as expeditiously as possible.
I think I'll interject now, Mr. Kazmierczuk, if you don't mind, since you only had a few seconds left. And Minister, I apologize for not...
Yeah, sorry, I apologize, but I have to leave. I have to leave at noon.
I was just about to say that I apologize for not being here to welcome you personally, but at the start of the meeting, but I understand you have to leave.
Unfortunately, yes. I wanted to say...
Sorry. Go ahead, Minister.
I just wanted to thank you, Mr. Chair. I find it slightly ironic that the last committee appearance I had was on March 13th, the day in which the House rose. And the first, I guess the next guest that you have at OGO happens to be me as well in the middle of this crisis. And I want to thank you and your committee for the excellent questions that I received today.
Minister, thank you for your appearance and thank you for your kind words. We look forward to seeing you again sometime in the near future, hopefully. Colleagues, while the minister takes her leave, we'll continue on. We do have officials that have accompanied the minister, and I see no need to suspend the meeting since we are virtually meeting. So we'll go directly to our next questioner, which will be Mr. Abulev. You have 5 minutes. Ziad, if you could unmute your microphone.
Yeah, sorry about that. Good morning to all, and I'm glad to see everybody's safe and hope your families too. The question is, we know that there's recent news about empty planes coming back to Canada from China without any PPE supplies. The question is why these planes came back empty.
Thank you, Mr. Chair, and good to see everyone. So in terms of the empty plane, a couple of things. There was a few empty planes that left the airports. Only one of them was Government of Canada. As was mentioned earlier, Mr. Chair, the Shanghai airports and all airports in China, in fact, are extremely busy. And the weekend in question was also a lot of bad weather going on. It was heavy, heavy rain. So effectively what happened was the goods were unable to get from the warehouse to be loaded on the plane in time for departure. And so we do have lots of planes lined up. Obviously the empty plane, not ideal, but because of the rules around crew and things like that, in terms of managing their workload and time in air, carrier had to basically take off with an empty load. We've since have additional planes in behind it, and we're getting ready to run about 1 plane a day in the near future. But that's kind of the congestion at the airport, heavy rain, and just unfortunate circumstances is the short answer.
Mr. Matthews, the crew is allowed to stay 12 hours, especially the overnight on the tarmac. So, and you've got 17 hours before you send in the planes, whether from Vancouver or from any other location in Canada. How come that we're not ready to load and be alert that we need to bring the product close to the airport, to the warehouses there, where we can just load the planes?
It's a little more complicated than that, Mr. Chair, in that the airport itself is extraordinarily busy. We do actually have a warehouse that we're making use of at the airport, and that's where we store our product. So basically, it's a constant lining up of goods to make sure they've cleared customs in our warehouse, ready to go, and then we have a protocol for which.
Why the private sector hasn't been experiencing those difficulties? It's a question that we need to ask, and I need to also ask how many cancellation we have had or you have had with Cargojet or with Air Canada, and what will be the cost of each cancellation when you do so?
So just to be clear, Mr. Chair, there was one Government of Canada plane left empty. It was not the only one. So this is not a unique Government of Canada issue, and I want to clarify that for the member. But it is, no matter who you're dealing with, nobody wants to send an empty plane home. Grosso modo, the cost of a flight, depending on the type of plane and the carrier and the load, you're looking at somewhere between $600,000 to $800,000 a flight. So that just gives you a
US dollars or Canadian dollars?
That should be Canadian dollars, Mr. Chair.
Okay. There's some. We know that Deloitte has been verified supplier, supply chain basically facilitator since April 1st. Now the plane was sent 4 days ago, and we have something to tell us that the government have bypassed Deloitte. That's why the plane or the planes, actually I've got more than one plane I believe came back empty. So by the bypassing of the government to Deloitte, then Deloitte did not authorize basically or did not verify the shipment. That's why the plane came back empty. Can you explain that?
Mr. Chair, I'm not sure where the member has that information, but at the end of the day, PSPC is accountable for what gets on our flights. We are using the assistance of the private sector. Deloitte plays a role in vetting suppliers and helping us with our supply chain, but the goods we're talking about were cleared by customs in the warehouse and ready for loading. So it had the actual issue of the plane not getting loaded had nothing to do with Deloitte's role. But at the end of the day, it's PSPC's job to make arrangements to make sure that cargo gets loaded, but it was not a Deloitte issue, so I'm not sure where that's coming from.
Do you have an exclusive contract with one of the airlines? I know that you mentioned, or the minister mentioned, Cargojet and Air Canada. Is there an exclusive contract of shipping the product or carrying the product by any of those two companies?
We have arrangements, Mr. Chair, with both Air Canada and Cargojet.
And Mr. Matthew, a very short answer, if we could, please, sir.
Certainly, we have arrangements with both Cargojet and Air Canada on an ongoing basis. Early on, we had used a couple of other carriers as well, but going forward, it's been Air Canada and Cargojet on an ongoing basis.
Thank you very much. Our next speaker will be Mr. Drouin. Francois, you're up.
Thank you, Mr. Chair. Question with regards to the relationship between PSPC and the Public Health Agency. How does that work? And after that, I want you to comment on, and I'm asking the question to Mr. Matthews, but feel free to pass it on to whomever is best to respond to this. But after that, PSPC and the relationship with the provinces, and how are the needs determined across Canada? And we've heard the minister said she has a bi-weekly call with ministers, but I'm assuming that there are many more calls that are happening with your counterparts at the provincial level. I'm just asking you to comment on how that works.
Thank you for the question, Mr. Chair. A couple of comments, and yes, as the member mentioned, I do have some friends with me, and I'll be happy to turn to them should I need some help. Public Health Agency, like other departments, is a client of PSPC. So when they place orders, we do our best to fill them, and we talk about schedules and need. What's unique about the current circumstance is in normal times, provinces and territories and other hospitals, et cetera, health authorities would do their own ordering. Because of the crisis, there is a role here for the federal government at the health tables with provincial and territorial governments. So there's been some collaboration with at the health through the health departments to put collaborative orders in place. So there's ongoing dialogue between the Public Health Agency, the Department of Health in Canada, and its provincial counterparts and territorial counterparts to assess orders, assess need, and then give PSPC effectively large orders to place. And those large orders are very important in terms of getting the attention of potential suppliers in a very competitive market, as was highlighted earlier. So that's the interplay. Ongoing need of provinces and territories is absolutely done through the health tables. That's an important dialogue there. And then our intersection is with the Public Health Agency and Health Canada. The table you're referring to that the minister referred to, she does have a regular check-in with her ministerial colleagues, which is a combination of, in some cases, provinces have put health ministers forward as their representative. In other cases, it's more of an equivalent to the minister of PSPC, just to have an ongoing dialogue about common issues, what we can do better, where the gaps are, and to help fill that in. But there are, as the member suggested, Mr. Chair, many conversations that go on amongst federal and provincial counterparts. The most important ones, I would say, are at the health table to talk about need, forecasts, and any potential shortages.
Thank you. And we've heard the minister also comment on how the personal protective equipment is distributed across Canada. I'm assuming that it's the Public Health Agency who's worked with their provincial colleagues to determine that particular formula?
That is correct. So it is worked through by the Public Health Agency of Canada with their colleagues, and that is both from an ongoing order perspective. Obviously, if there's an acute shortage that pops up, you will be taking steps to manage that. But it is worked out with the Public Health Agency of Canada and counterparts. And I take it that sound means I'm out of time, Mr. Chair.
You've got about 2 minutes left, just slightly less than 2 minutes.
Okay. Thank you. The distribution formula is done through the Fed provincial tables, and it's a predetermined formula for ongoing need.
And just in terms of the contracting, talk to me about how the contracting works and how that's changed potentially from the sense of urgency within PSPC to contract. Have you deployed an internal SWAT team to deal with particular companies in Canada? And we've also talked about ramping up capacity in Canada. How does your department work with different companies to make sure that we've talked about ventilators. We've heard the great stories in Canada, but how does your department engage with them to make sure that they can produce those protective equipment?
So there's a couple of aspects to that question, Mr. Chair. In terms of how we're organized within PSPC, it's by product group. So we would have a group that's dedicated or experts in masks or ventilators, or you pick your product. So that little mini teams. We also have hived off, Mr. Chair, a specific group to look at the logistics. Obviously, it's only buying things is one thing, but making sure they come back to Canada is another. So we've got a dedicated group that's doing the logistics part of it, which is an important role here as well. Ongoing dialogue with Canadian industry. Our colleagues at ISED would start by identifying potential companies, look at opportunity potential. And then when it's time to move on to exploring a contract, we would get engaged to talk about their ability to produce, how quickly, what the products are, and the contracting would be more in our realm of responsibility.
Thank you very much. Colleagues, we'll now go to 2 interventions at 2.5 minutes each. Madame Vignola, you were first up. You may have to unmute your microphone, Madame.
Thank you very much, Mr. Lukiwski. I have a bunch of questions. Here's my first. You said that Air Canada and Cargojet are bringing us medical supplies. Aren't there other Canadian companies who could help us out? For example, Air Transat or WestJet? There are many other Canadian companies. So why only Air Canada and Cargojet? Thank you for your question. For the time being, Air Canada and Cargojet are the only two airlines to have received the necessary approvals to run flights from Shanghai to Canada. We are in talks with other airlines, in talks with them with a view to getting them the necessary approvals so that they can contribute to our efforts. In our opinion, the more airlines, the better. That said, approvals take time. In the meantime, we are working with our team in China. We are doing everything we can to help out our suppliers. Thank you. Now, Deloitte, that's an accounting firm. I'm trying to understand something. Why is Deloitte handling the logistics and the coordination on the ground there? The government seems to have chosen Deloitte for logistics, and why is that? Thank you for the question. Deloitte is an accounting firm. Yes, that's accurate. But it's also a consultancy firm. To handle this crisis, we need experts, external experts who are from outside the government. So Deloitte is helping us, yes, as well as a company called Bolloré. Bolloré is a company of experts in transportation. They are assessing the capacities of Chinese companies. They're also helping us solve problems that arise.
Absolute logistics experts who have a good footprint
And
in
Mr.
China.
Matthew, unfortunately, we'll have to cut you off there. As I mentioned earlier with the minister, should you have any answers that you did not feel you had adequate time to respond to in the time allocated to you for those responses, I would ask that you complete your answers by sending a written response to the question through our clerk, and that will be distributed to the entire committee. Our final 2.5 minute intervention will come from Mr. Green. Matthew,
Thank you very much. Thank you very much, Mr. Chair. And just as a reminder that I do have at the appropriate time a motion to put under section 108 of our standing orders. As it relates to
Mr. Green, then if I may, Mr. Green, I would suggest if you've only got 2.5 minutes.
I wouldn't put that now. Can I put that in is it, no, this is it?
You can certainly do it now if you wish, sir.
Is there a more appropriate time?
Well, I'm not sure, Mr. Green, if you'll have one more intervention of 6 minutes after this one. So that would be your last opportunity.
Okay, but I'm not sure where we're going to be at. So I'm just going to go ahead and put this that under Standing Order 108, which is the shared portions under the 43rd Parliament, powers of standing committees, section 1A, standing committees shall be severally empowered to examine and inquire into such matters as may be referred to them by the House, to report from time to time and except when the House otherwise orders, to send persons, papers, and records to sit in the House when it is sitting and to sit during periods when the House stands adjourned, to sit jointly with other standing committees and to print from day to day such papers. You will have these in your standing orders. So my motion that has been placed as a notice of motion, I'm now putting it as a motion, that in context of the studies of the government's response to COVID-19 pandemic and pursuant to the Standing Orders 108, subsection 1A, that the committee send all briefing notes, memos, and emails from senior officials prepared for the Minister of Health, the President of the Public Health Agency of Canada, the Chief Medical Officer of Canada, and the Minister of Public Services and Procurements between 2010 and present date regarding the stockpiling, management, disposal, replenishment of medical equipment and supplies in the National Emergency Strategic Stockpile, that the committee received the information no later than May 25th, 2020, that matters of cabinet and confidence and national security be excluded from the request, and that any redactions to protect the privacy of Canadian citizens and permanent residents whose names and personal information may be included in the documents, as well as public servants who have been providing assistance on this matter, be made to the Office of the Law Clerk and the Parliamentary Council of the House of Commons. Mr. Chair, you will note that a similar motion passed through the Health Committee on February 29th using the same provision under Section 108. I just don't know that I'm going to get my 6 minutes next, so I'm just going to go ahead and put this now.
If you're taking speaking orders, Mr. Clerk.
And I should also note to my friends present that I did respectfully not put this while the minister was here, understanding the tight time constraints and the technical challenges that we had.
Mr. Chair, I believe your mic is on mute.
I'm sorry, Mr. McCauley, I think I saw your hand raised. Did you have something you wish to share with the committee?
No, just that I support Mr. Green's motion. I think anything, especially at this time, that's going to increase transparency to the entire issue is incredibly important. We need more openness, more transparency now more than ever. So I fully support the intent of the motion. And I thank Mr. Green for bringing it forward.
Am I allowed to speak to the motion?
Yes, briefly, if you can, Mr.
Yep,
Green,
I'll be
because
very
following
brief.
that, I will be compelled to make a ruling on your motion.
Sure. So we've heard today that this minister has stated that they have no role to play in the national emergency stockpile. We've also heard public health experts suggest that there's going to be multiple waves of potentially COVID in future seasons. My concern is that if we're not adequately preparing for, now particularly in the hyper-competitive purchasing environment, the replenishing of our stockpiling, the insurance that comes, the next wave, that we're adequately prepared, as well as retroactively looking at ways in which perhaps we need to share responsibility if we are responsible for the procurement and the logistics chain, right up to when they're being not only delivered, but also when they're being disposed of, because I'm still to understand that under this ministry that there is a responsibility for the distribution of goods before they become expired, and I would like to have better information around that, because there's been a lot of ambiguity around that, Mr. Chair.
Thank you, Mr. Green. I understand, Mr. Drouin, you have something to add as well?
Yes, Mr. Chair. I just want to point out a few things that Mr. Green has mentioned. He's referred to the February 29th motion that was adopted by the committee, and I want to remind Mr. Green that that was prior to the House officially standing adjourned. It is my belief that members, while they can present motions, only pertain to witnesses, and I would digress to you, but from our understanding is that members, when the House is adjourned right now, as the rules were presented to us, is that they may present motions, but only as it pertains to specific witnesses.
Thank you, Mr. Drouin. I do not see any other hands raised wishing to participate. So in that case, I'll make my ruling now. Mr. Green, I'm going to have to find that your motion is inadmissible, but I do want to give you the rationale why. Number one, the House order that was adopted on April 11th was quite specific in my view, in which it stated that the purpose of this meeting and subsequent meetings are only to deal with the COVID-19 pandemic and the government's response to it. Additionally, it said that the role of the committee is to receive evidence. Now, there was some discussion that the motion passed on March 24th talked about a reduced quorum, and because of that reduced quorum, it had some restrictions on motions being presented at committee. Some have argued now that we are back with a full quorum and having video conferences that reduced quorum restrictions should be removed. However, the order of April 11th was quite specific, stating that the exception to a normal practice of committees being able to introduce motions is now in effect on these committees. And as a consequence, the only motions that may be accepted are the motions pertaining to the scheduling and appearance of witnesses and the testimony that they may provide. So as much as I have great empathy for your motion, Mr. Green, and I agree with Mr. McCauley that I think it would be wonderful for all of us to receive as much information as possible during this difficult time, we are constrained, and I as chair am particularly constrained by the terms of the motion that were passed. They being quite specific, your motion, unfortunately, Mr. Green, I have to rule is inadmissible.
I appreciate the thoughtful response. Clearly, you've given it some jurisprudence, and I'm happy to hold this notice of motion. Sometime we do make it back to the House, it will be put.
Thank you very much. We will now go to our second round of questions, and we will start with Mr. Chair. I don't have my list in front of me. Is Mr. McCauley first up? Mr. McCauley, 5 minutes to you.
Great. Thanks very much, Mr. Chair. Mr. Matthews, maybe you can consider finding these documents that Mr. Green has asked, even though it's not a legitimate, so to speak, motion. Maybe we can share them with the committee. I want to get to a couple of things regarding the contaminated supplies. Like, for example, the 1 million masks and the other contaminated items. Were these items prepaid? Are we getting the money back for that, or is that money just gone?
So on the mask front, Mr. Chair, and thank you for the question, and
the other items.
So we can address both if you wish, Mr. McCauley, or Mr. Chair through Mr. McCauley. The masks, the company has committed to supplying all acceptable product, so they're standing behind their product. We have an ongoing relationship with them. We are looking at the masks in terms of what can be done with them. So that will okay. The relationship with the supplier will continue, and they're standing behind their product, Mr. Chair. But they're not appropriate products for Canada, and therefore we've got 1 million masks that we've bought that cannot be used for what they were purchased for. Is the supplier keeping that money? We've also heard of contaminated swabs and that. Is this money gone, or are we allowing them to keep the money? If so, how much for contaminated or equipment that is brought in for Canadian purposes that does not meet our standards? How much money have we spent on that so far? So in both cases, Mr. Chair, we have ongoing relationships with the suppliers, and they are working to address their quality issues. And in the case of the swabs, it was a pre-existing relationship, so it was a bad batch. And so both our expectation, Mr. Chair, is that both companies will stand behind their product and make things right. Okay. You're not answering the question, Mr. Matthews, and frankly, I don't think Canadians care if we have a pre-existing relationship with a supplier. We cut them a check for products to be used for our doctors, our nurses, protect our elderly. They're clearly not acceptable for that purpose. Are these suppliers keeping taxpayers' money, or will it be refunded to us? So if it's not going to be refunded to us, how much money then have we spent on supplies that is not appropriate or does not pass Canadian standards, please? So I'll try one more time, Mr. Chair. The companies for the mask in question, they are going to provide replacement product. So if they do that, will this replacement product be up to our standards? Well, they are adjusting their production, and we're seeing new product now. And to be acceptable to us, it has to meet our standards. Okay. So the 1 million masks that we considered unacceptable, they're going to replace them outright without any additional cost to taxpayers, is what you're saying? We are expecting them to stand behind their product. They have indicated they would. So, Mr. Matthews, Mr. Chair, it's a straight yes or no question. Canadian taxpayers have a right to know, have we purchased 1 million masks that are unsuitable to protect our doctors and nurses and our seniors? Are we getting that money back? So, Mr. Chair, and are they going to replace them with appropriate products for Canadians, for our doctors and our nurses, or are we just going to let that money go away? It's a simple yes or no question. I don't believe it's a simple yes or no question, Mr. Chair. The company is going to supply replacement product to back up the masks. The reason I hesitated on that is not a filtration issue. We've got issues with the masks, a large part of them with our elastics. So if they can be used for something else, we will absolutely use them for something else. But these masks never made it into the medical system. To make it in, they have to pass the inspection of PHAC and meet Canadian standards. So our expectation is we are getting replacement product. At no extra charge. That is my expectation, Mr. Chair. Okay. How much in total have we spent on items that have not been deemed acceptable for our standards? So the two examples that are in play from a quality perspective, Mr. Chair, are the swabs, which were arrived and were not sterile, and they were put back into the system after sterilization. And I'm going to turn to Ariane Reza to get an answer on the swab question. But just to ballpark, how much should it cost us then to fix those swabs? And are we paying for it, or are the supplier paying for it? I'm going to have to let Ariane answer the swab question if she can, and if not, we can circle back. On the mask question, you're seeing a range of prices for masks, Mr. Chair. When this crisis started, we were looking at about $1.20 a mask if you had orders early on. More recent orders, you're seeing prices quoted up to $5 and $6 a mask for N95 respirators. So the cost of masks depends on when you placed your order, frankly, and when you had your arrangements in place. And maybe I'll flip to Ariane if she can shed some light on the swabs.
So if the stockpile had been stocked up, we would have saved a lot of money, is what you're saying as well. Ms. Raza?
Hello. On the swabs, this was the first batch of swabs from the supplier. The supplier recalled them and will be providing us with new swabs. In the interim, we did have success in sterilizing them just to provide additional contingency to the Canadian healthcare system.
Okay. How much did it cost us to sterilize those swabs, and are the replacement ones coming at no charge?
The replacement ones are coming at no additional charge to Canada, and I don't know the price of the sterilization. Will come back with a written response. Maybe
you can get back to us. Mr. Matthews, are there any other examples of products that we've bought besides the masks and the swabs that haven't met our standards?
They're the two that I'm aware of, Mr. Chair, and obviously making sure that we buy goods that meet the needs of, respect our standards are very important.
I realize it's very, very difficult, and I'm not saying that you specifically, but obviously if we're buying items for Canada and there's not appropriate, I don't think taxpayers should be on the hook. How much time, Mr. Chair? You have to unmute yourself.
I know, Mr. McCauley, you've only got about 15 seconds.
Oh, okay. Thanks very much, then.
Thank you very much. We will now go for 6 minutes to Mr. Drouin. Francis, you're up.
Thank you, Mr. Chair. I thought Mr. Jauhari would be going, but I'm happy to interject unless Mr. Jauhari, you want to jump in.
Mr. Drouin, you got my speaking order had you, but you can certainly cede your time to anyone on the government side should you wish.
That's fine. No, I'm happy to continue on my side because we are at the start of the second round.
Okay, I'll go back on mute.
Yeah, that's correct. I have to remind members, though, we've got about 20 minutes left, at which time I will be suspending the meeting, excusing our witnesses, and we'll be going into the last 10 minutes of the meeting to discuss upcoming meetings and the work plan. So we've got about 20 minutes left, which would give us, I believe, 3 more interventions. Mr. Drouin, yourself, Madame Vignolia, and Mr. Green. So Francis, if you want to take us off, we will start now.
That's great. Thank you, Mr. Chair. And I just want to advise we had been in discussion with Miss May if this is going to be the Liberals' last round. So I would like to share about 3 minutes with Miss May in the spirit of cooperation. Just a couple questions with regards to some of the barriers that may exist for companies that do want to sell into Canada. And we know there's an approvals process with Health Canada that has to allow them to sell medical devices in Canada. And I just want to know, Mr. Matthews, does your department know once they identify a Canadian company, do they encourage them to talk to Health Canada to allow them to sell, to get their special license?
Thank you for the question, Mr. Chair. And member is quite right. There is licensing requirements when you're dealing with medical equipment, the MDE license. And there's kind of 3 aspects to it: manufacturing, distribution, and importing, and all 3 are important. And through the outreach we've had with Canadian industry and others, in fact, there's an uneven understanding of some of those requirements. So where we're dealing with a potential supplier who does not either possess the required license or is not sure how to go about it, we very quickly make links with Health Canada to allow them to kind of facilitate that process to the extent they can. And there is an accelerated process in place. And it is a world where there's different categories of licenses. So, category 1, which would be kind of the least complex, which is PPE, all the way up to something that's more complex, like ventilators, you can understand would have a more complicated application process and evaluation process than something that's less complex. So putting them in touch with the right people on the regulation side is critical to helping them out. And as I said, we've got some companies who've come in who already have a license, understand the system very well, and know exactly what to do. And we have others who are kind of breaking new ground as they try and find their way into a new industry.
And are you aware of the different categories? Like, for instance, we've often had discussions about visors, and I know one company in my riding innovation tool got the license fairly quickly. But I think what helped them is that they also worked with the local hospital to make sure that the model and the innovation that they presented in those visors would meet the adequate need of the medical community. Is it harder to qualify for, I don't know, category 1, category 2, et cetera, et cetera?
It is the higher the category.
And Mr. Matthew, if you can complete your response in less than 30 seconds, we want to go to Ms. May for 3 minutes after that.
I will do so, Mr. Chair. The higher level the category, the more complex, so the more steps and information is required. So most PPE would fall into the category 1 level, which is the most streamlined, but there's still some steps involved.
Thank you very much, Mr. Matthew. Madame May, welcome to our committee. It's good to virtually see you. You have 3 minutes.
Thank you. Very happy to see you as well, Mr. Chair. My first question is one at a higher level of analysis than we've been getting at so far in the committee, and that is the lessons from SARS and that experience. We were supposed to be paying attention to making sure we had PPE, to make sure we had stockpiles. Now, where was that primary responsibility lodged? Is it in the department that we're talking to today? Would it have been public health? Can I ask the officials who was primarily responsible for making sure we didn't forget the experience of SARS?
So from a policy type questions or levels of stockpile type questions, Mr. Chair, that would fall squarely in the circles of Health Canada, Public Health Agency of Canada. The role of this department, I think most people are aware, is to actually go and procure, but we usually procure when we have a client who will instruct us on just what it is they need.
Thank you. That's very clear and helpful. In terms of what you've experienced since the COVID-19 crisis began, and I think some of the other questions, I think Mr. McCauley was getting at this too. When were you first given instructions that we needed to really bulk up our procurement around PPE?
So the calendar, if we reflect back, you would have seen some minor small orders kind of towards the end of January, early February. The first big order, collaborative one with the provinces. So this is where public health and came in with a big order that involved multiple provinces. You're looking at March 10, March 11th when we received our first big order, and that would have been done after several weeks of consultation amongst the various health authorities in the provinces, territories, and the federal government.
And as things stand right now, if I can squidge in one last question, as things stand right now, what is the commodity, the product, which gives you the biggest headaches? Which ones are we most likely to experience any shortage, or are you comfortable that we've got what we need for the next few months?
Thank you, Mr. Chair. It varies by the week, frankly. So 2 weeks ago or a week ago, if I was here, I would be talking about swabs. That's under control. I think the N95 respirators are one that we are still actively managing. Others, like surgical masks, very much in control, good supply of good, high quality masks coming into the system.
Thank you very much, Mr. Matthews. Thank you, Mr. Chair.
Thank you, Ms. May. And we will go to our final 2 interventions for 6 minutes. Madame Vignolia. Madame, you may have to unmute your microphone.
Bon. Merci beaucoup. C'est à mon tour, bien?
Thank you very much. My turn. I'll still talk about stock management. So I know that PSP is responsible for procurement and must wait until Health Canada or Public Health Canada tell them what they want before they go ahead. However, I would like to know more about procurement and stockpile management. Obviously, some equipment did not get distributed. I just don't understand how equipment can be stockpiled, how that equipment can get close to best before date, and nobody just realizes that they should be distributed. I'd like to know how that is possible.
Thank you for the question, Mr. Chair. A couple of thoughts on this one. First of all, process would be number one, get the goods into Canada, get them cleared through customs, and then actually get them warehoused or counted so we actually know what we have. So that's part of this process. As we have discussed in earlier questions, there is then a process of quality assurance where samples are tested so we make sure, not we, PHAC, Public Health Agency of Canada, makes sure that the goods are indeed up to standard. And then they're put into the system for distribution. The vast majority of the goods, once they clear those two processes, do go directly out to provinces. And there is a small percentage that is held inside the Public Health Agency warehouse for additional urgencies. But if a province needs something urgently, they would be in direct contact with the Public Health Agency of Canada to get urgent distribution.
OK, mais au moment où on voit que la date...
When one sees that the best before date is getting near, let's say it's 2, 3, 6 months into, one knows that in 2, 3, 6 months, that product won't be any good anymore longer. Why isn't there an alarm mechanism so that there is no waste?
Of understanding that the goods that are coming in now are basically for current use, but there's also the idea is to have a steady stream of PPE arriving for distribution to provinces and territories. So it's not a matter of sending everything out the door all at once, but it's a steady stream. And some of the orders that are coming in now actually relate to orders we have placed on behalf of provinces and territories. So those goods would go right to the province and territory. There are others that, the stockpile exists for when there's a critical shortage. And again, I do want to remind members, Mr. Chair, that provinces and territories and health authorities are busy doing their own ordering at the same time. We are not their sole source of supply, is what I would say.
OK, mais ça répond pas. Je comprends que...
Fine. I understand how things are now. However, in the past, resources were wasted, and I just don't understand how there was no red light, no alarm, how no one called anyone. I mean, from what I've heard, no one called anyone to say, we've got this equipment nearing to its best before date. Would you like some of that equipment? It's good to renew your stockpile, but you can distribute what is past its date.
Et il est où le manque dans le processus?
How come there is no warning mechanism?
I think what I'd say, Mr. Chair, on this, and this is a better question, I think, for the officials who run the stockpile in terms of how they deal with surplus. I think, keeping the stockpile fully stocked with its whatever levels they decide are necessary, that's in their responsibility. How they would go through and decide what can be what's expired and is not usable versus what can perhaps be repurposed. I'm not sure you've got the right folks at the table to properly answer that question.
Je vois aussi qu'on est très dépendant de
I also see that we are heavily dependent on international procurement. Some Canadian companies have stepped in, but a lot have turned to have outsourced procurement production. Will the government review its policy when it comes to domestic supply?
Merci pour la question, Monsieur le Président. Je dirais que...
Thank you for the question. When it comes to the fact that Canadian companies produce certain things, that is a question for Health Canada. However, procurement from other countries is vital. However, now, when it comes to producing things locally, we've done that with hand sanitizers, face shields, and that has been done successfully. Next.
Happening on gowns.
Thank you very much, Mr. Matthew. Our final intervention for 6 minutes. We'll be back to Mr. Green. Matthew, you're up.
Thank you very much, Mr. Chair. And so we've heard today, as characterized by the minister, that Amazon, first characterized, was a Canadian company, then, of course, corrected to say that it was a company that had Canadian operations. We know that the owner of Amazon has profited, I don't know, something like $24 billion during COVID. We know also, at least to my best knowledge, somebody perhaps here can correct me, that I don't believe they pay any federal taxes. What do we have in place to ensure, based on the descriptions that we've had on their logistics, that even though they're doing this at no cost, that there isn't an ability for there to be self-dealing on their platform? Notwithstanding the fact that they're going to still be selling these items, is there any possibility, or has it been explored for potentials of self-dealing between the Amazon platform and the logistics works that they're doing with us for the federal government?
Thanks, Mr. Chair. There's a lot in that question, and some of which I cannot answer in terms of income tax, et cetera. But in terms of the arrangement that the government has reached with Amazon and partners, it's dedicated to allow for basically ordering and distribution of the federally acquired goods and services, or sorry, goods, not services, goods. So it's distinct from their regular operations. What's unique about Amazon in this case was their outward-facing retail platform that would let provinces and territories effectively put in orders for PPE to the national warehouse. And so that's the unique feature there. The warehousing and distribution has been mentioned. It's Amazon plus Canada Post plus Purolator. So it's very much a distinct arrangement at no cost, no profit to for the first few months, and we'll go from there. But it's very much distinct. I wouldn't view it as being mixed in with their regular operations.
I just can't see how on the back end of their logistical supply chain that they wouldn't have information. We've heard about the price gouging of all the PPEs, on the market, and they are providing at no federal, tax implication. They are providing perhaps the largest online avenue for that in the private sector. I'm very concerned that there have been 3 reported cases of COVID in the Canadian operations. I'm very concerned with the reports of significant labor violations in the United States and in Paris and in their global operations. And I'm wondering, what do we have in our abilities, in our tools, given that they are now a direct supplier of the service to us, to ensure that they are providing a Canadian standard of public health respected workplace environments, knowing that they're going to be having 1,000 new hires. So business is brisk. How do we ensure that our suppliers, such as Amazon, are going to be maintaining the kind of public health safety that we're going to need in order to head off any potential significant vector for COVID distribution around the country, literally door to door?
Interesting question, Mr. Chair. I think the answer would be the same for all industry. They've got to find ways to keep their workforce safe as they do this very important work, and they, equally interested as are we in keeping the workforce healthy. So in discussions around how they would organize themselves to deliver this service, there were discussions about the workforce. They will continue, but obviously they have to respect whatever rules are in place from a public health perspective in order to properly protect their employees.
And we know that they've made billions and trillions of dollars off of supply chain. We know that if they have in their stockpiles a certain number that becomes to a place of depletion, that they'll have automatic systems in place to be able to restock those things. And going back to the National Emergency Strategic Stockpile, it has been suggested through this committee now multiple times that there's no real role for this ministry in the operations, that this is solely on PHAC. I'm going to go ahead and make the statement in fact, that it's very clear there's been a mismanagement of the stockpile. I need to know that in the independent recommendation, the assessments, the recommendation to move from 9 warehouses to 6, Regina was one that was closed. What are the other ones that were closed? And were those stockpiles also disposed of?
So I think, Mr. Chair, those are questions that are better placed to the Public Health Agency or Health Canada. I'm not sure I can
Has there been any
questions.
discussion, given the scale of the emergency? I know some people might say that this is all, retroactive. It's hindsight. But has there been any discussion of having an integrated committee so that it doesn't leave the sole responsibility for PHAC to run the national stockpile? Has your ministry reached out to their ministry to say, hey, we do this stuff day in and day out, we understand logistics, perhaps we should be involved in this for future emergencies? Has that conversation happened?
Well, Mr. Chair, the ongoing relationship with the health agency and our agency is one of procurement. So there is a handoff in terms of when they order things. We have dialogue with them about what's coming in when, and then how it arrives in Canada and gets placed into their system. Obviously, we helped the Public Health Agency in negotiating the arrangements with Amazon, Canada Post, and Purolator. So there is ongoing dialogue in terms of how we work together.
So last question, it's a very clear one. Are you aware of what the minimum supply of the emergency stockpile is? And are there any mechanisms in place that would flag for you whether or not it's reached those critical points? Or are you solely relying on PHAC? Because if that's the case, we got a significant problem here understanding what's just transpired over the last year and a half.
And Mr. Matthew, if you can answer that in 10 seconds or less, I'll let you go ahead. Otherwise, I would ask that you give a written response to Mr. Green's question through our clerk.
I will give the 10-second attempt, Mr. Chair. The responsibility for the levels of supply in the stockpile, as well as their upkeep and currency in terms of expiration dates, is 100% in the domain of the Public Health Agency.
But I look forward to having the Public Health Agency before us sometime in the near future.
Thank you very much. Colleagues, I will now excuse all of our witnesses with our thanks. Thank you very much for participating virtually. And we will go directly into the last few minutes of our committee meeting, which will be held in public, colleagues. We are not in camera. I just want you all to realize that. And the purpose of this last few minutes is to discuss our future meetings. And we have a work plan that has been developed, which was sent to all of you, I believe, yesterday. And perhaps, Mr. Clerk, we can invite Raphael to present the work plan, or how would you like to do it, Mr. Clerk?
I would suggest Raphael take the lead on this.
Raphael, please.
Yes, thank you, Mr. Chair. So as you mentioned, committee members should have received a copy of the work plan, and we included all the suggestions from all parties, as well as some of our own, and we tried to group them through several themes. So we had the first meeting today with PSPC, and as member can see on their work plan, the second meeting is with federal departments supporting businesses. The third meeting would be about medical sector businesses and a research hospital. Just let me scroll down. The fourth meeting will be on distribution of medical supplies. The fifth meeting on cybersecurity. The sixth meeting on the allocation of emergency benefits and federal employees that are all teleworking, or most of them. Finally, the seventh meeting will be on emergency benefits. The eighth meeting will be on oversight of government activities. Ninth meeting on representatives from Alberta and a non-for-profit organization. And finally, the 10th meeting would be on industry groups. And I believe some members would also like to have the Public Health Agency of Canada added to it.
Thank you very much. I will entertain questions. I see Mr. McCauley has his hand up. If you want to, colleagues, as well, participate in questioning. Raphael, on your screen, near the top of the screen, you have an icon saying participants. If you click on that, there is an opportunity for you to raise your hand. And that way I can take a look virtually and see what everyone is doing and who might have questions. But Mr. McCauley, I saw you first, so you're up.
Oh, thanks, Mr. Chair. Just a couple of things, and I'd love everyone's feedback. I think we should invite Mr. Matthews back. I don't think we need Mr. Muldoon necessarily or Mr. Vandergrift, but certainly Mr. Matthews. I think there's a lot of outstanding questions. We could have him. My only other thought is just the lineup is maybe the issues with CERB and some of the others should be moved up closer. So we're doing them sooner rather than week 6, like some of the eligibility issues and that. And I know it might be difficult, but I just thought maybe some of those items should be moved up a bit sooner. But thanks.
Are there any other questions or comments from committee members?
Yes, Mr. Chair.
I have first. I've got Mr. Juan, and then we'll go to Mr. McKinnon.
Okay, just a couple of comments on, and I would ask the opinion of the committee. I've noticed some names where they may not be the proper people, so I would hope that we would allow especially when we're inviting departments to appear before the committee, I would hope that we would allow the deputy minister to decide who the best person is to answer. And just to give you one example, Paul Girard, for instance, he is the CIO for Treasury Board, but only internally. So he wouldn't know necessarily the IT policies of the other departments. He only deals inside of Treasury Board. So unless that was the intent, I'm just not sure how COVID related that would be to the particular committee. So I would ask that we would allow that liberty for deputy ministers to allow them to decide, yes, this is my point person on COVID-19, and no, this person has nothing to do with COVID-19.
Thank you. We'll go now to Mr. McKinnon.
Merci, Monsieur le Président, et bonjour tout le monde. Moi, j'ai plutôt...
Thank you, Mr. Chair. Hello, everyone. I have a comment. This list, this proposed witness list, it's very long. And in normal times, we would say that a lot of these witnesses might not be relevant for OGO's purposes and for OGO's mandate. Here's my comment. We're going to hear witnesses, be they suppliers or external groups. And so I'd like to remind the committee that we are in a crisis, which means that we must be very prepared. And these witnesses have to do a lot of preparation, many of whom are not really used to testifying in parliamentary committees. I'm wondering, should we take a look at this proposed witness list, keeping in mind that we're in a crisis and keeping in mind that external and internal partners are participating a lot. And so if they are invited to testify in this committee and that committee and all the committees that are currently operating, well, that's a lot of work for these witnesses. Could we maybe discuss that? Could we coordinate with other committees? For example, X witness will appear before your committee and Y witness will appear before our committee. So, food for thought. I think that this proposed witness list is very long.
Thank you, Mr. McKinnon. Thank you. We'll go now to Mr. Green.
Thank you very much. And certainly, I don't think any of us in this committee need a reminder of the emergency we're in, nor the seriousness of the work that we're undertaking. But having said that, I'm seeing some situations here where there is sections that are, heavily dominated. For instance, if you were to look at the third meeting for the medical sector and the business research hospital, almost exclusively dominated by folks invited from the governing party. I'm wondering, where are the representatives for some of the workers in order for us to get firsthand lived experience and not necessarily corporate reporting on what people are facing.
Raphael, before I put it back to you, because I don't see any other hands raised, a couple of points or a couple of questions I would have for you. Mr. McKinnon's point was, would it, if I'm interpreting him correctly, he's asking, would it be possible for you as analysts to coordinate with other committees to ensure that we're not duplicating efforts in terms of witnesses coming to testify? The second thing Mr. Green, I believe, has asked is that whether or not we would be able to get, for the lack of a better term, real people, perhaps frontline medical workers to testify as opposed to government officials and bureaucrats. Now I see we have a couple of other questioners, Madame Vignola and Mr. McCauley. Mr. Green, you want to finish off your thoughts?
Yeah, if you don't mind. I do respectfully just want to make sure that we are also including, unions and union reps. They're certainly very active on the file, and we want to make sure, as was identified today, that programs that are being offered to the broader public, that as employers, that we're taking care of our workers in the same way, with the same considerations and the same compensation, or better.
Yeah, and I would, of course, point out, Mr. Green, and to all committee members, should you have any specific suggestions for witnesses, please submit them through our clerk, who will get them to our analyst. The analyst can only propose a lineup of witnesses based on the information that they receive from the committee. So should you have specific union representatives that you'd like to come appear, please get those names in through the clerk, and the analyst will then obviously take that into consideration. Madame Vignola, you're up.
Good. C'est mieux?
Is this better? All right. I agree with Mr. McCauley. I feel that we should address the CERB earlier. We have many questions that we keep hearing from our constituents. We should also, yes, avoid having witnesses testify before many committees. And we should also make sure that witnesses are familiar with committee functioning and be able to answer quickly. All three suggestions that have been made, I agree with them.
Mr. McCauley, followed by Madame Block.
Great. I take Mr. McKinnon's comments, and I understand with them. A couple of things maybe you can share with us, not right now, but by email, who you might think is overlapping or redundant. My concern with not having the deputy ministers there, as we may have listed, is we've seen repeatedly in the past where we get people who show up and their only answer is, well, that's really not me anyways, that's someone else within the department. We've seen already a lot of passing the buck on issues. I'd hate to see a continuance of that. We can certainly go back, those of us who have put on the witness lists deputy ministers, or perhaps if it came from the analysts, they could have another look to justify. But I'd be very wary about having deputy ministers not show up in order to have other people who could not answer questions.
Thank you. Kelly Block.
Thank you very much, Mr. Chair. I'll just make 3 points. I think firstly, to Mr. McKinnon's intervention, witnesses may decline. And I'm sure that if we were hearing from some of our witnesses that they have attended many committee meetings and are not able to focus on the job that they need to do, we would probably be gracious enough to accept that decline. I think even though—
Kelly, if I can interrupt just for a second, and I'm sorry, the volume on your microphone is very low. I don't know if it's been disconnected from your laptop or you're just a very soft speaker. I know that normally, but I'm having some difficulty hearing you. I wonder if you could just increase the volume somewhat.
Okay, let me try again.
That's perfect. Thank you.
Okay. My first point was to Mr. McKinnon's intervention. Witnesses can always decline to attend. And I'm sure if they provided us with a rationale that made sense in terms of their time taken up in other committees or the fact that they aren't able to do their work, I'm sure we could extend grace to them for that. I think when they attend other committees, the focus may be very different in terms of the questions being asked. And I think the reason why we may be seeing some overlap early on is because not a lot of committees were meeting. And so I know that the Health Committee, for example, invited witnesses from PSPC because there were questions around procurement, and OGO wasn't meeting and able to ask those questions ourselves. So I think some of these issues may iron themselves out. I would not want us to say no for people, and neither would I want us to not do our due diligence on this committee, asking the questions that we feel need to be asked around procurement.
We can't hear you, Tom.
Pardon me?
I'm sorry, Mr. Chair, we can't hear you.
I'm sorry, Mr. Clerk, I didn't hear you.
You're good now.
Okay, thank you. Yeah.
No, Mr. Chair, there's something with your microphone. We're not hearing you again for some reason. I don't
Your
know.
hand's likely covering the mic on your phone.
Yeah, I'll get onto this new technology eventually, Matthew. Raphael, I'd ask you to make a quick response to that, and then I'll have a couple of closing comments. But based on the comments and suggestions you've heard, do you feel that you will be able to either revise your work plan somewhat and get that revised work plan out to the committee members in short order, or give us your thoughts, please?
Yes, well, I would ask members to send their comments, the names that they find that are duplications through the clerk, and as well as new witnesses, maybe by early next week, and then we can provide a revised plan based on those comments.
Okay, thank you very much, Raphael.
Mr. Chair?
Yes, Mr. Chair.
What?
Just Mr. one Clerk, I'm sorry. Paul, you had your hand up. I'm not sure if you were the first to raise your hand.
I believe Mr. Drouin outranks me, so you should go to him first.
Well, clearly,
now.
Mr. Drouin probably outranks everyone, but we'll go to Francis. Go ahead, Francis.
Wow, I hope my mother can hear that. Just a quick question on procedure. So we had to end the meeting 15 minutes earlier, and I'm just trying to say, how can we, I know other committees do a side meeting to discuss witnesses, and I'm just wondering, Mr. Chair, if we could do that as well prior to, not every week, but maybe once every 2 weeks to discuss the upcoming witnesses, so we can, at a time where we're not officially meeting, so we can use the full 2 hours to ask questions. I'm just wondering what the feel of this committee is.
Yeah, and my apologies again. I was the cause of this committee starting 15 minutes or however many minutes it was past the allotted time. Unfortunately, we only have a 2-hour block simply because there are many more committees coming on stream now who will be having virtual meetings at the same times as us, and we only have so many interpreters that are available. So we have to be somewhat cautious about extending time or trying to break into others who may have requested a specific meeting time as well. Specifically, Francis, yes, I have no difficulty whatsoever getting together one more time or even several more times to discuss potential witnesses, but I think Raphael's comment was very apropos. Should anyone on this committee have any witnesses right now that they would like to see appear, please get those names in immediately. And then I will wait till I see what Raphael has come up with in terms of a revised work plan. And then Francis, perhaps we can have another informal steering committee meeting as we did last Friday. Okay. Steve, I understand you wish to share some stuff with the committee as well.
Well, I won't harp on this. I just want to say, Mr. Chair, look, there are, I think, 4 committees operating, if I'm not mistaken. Maybe there are more, but they're all doing their own witness lists. I just want to state the obvious. You know, the Health Committee has a specific mandate to oversee the Department of Health and the Public Health Agency. I don't know who's appeared where, but it strikes me that either through you, Mr. Chair, or the committee staff, that we may want to ask the Health Committee who they intend to, or have in fact convened, and kind of coordinate that so that we're avoiding enlisting the testimony repeated across committees of very busy people, or B, getting people, asking people without coordination from outside of the Government of Canada apparatus to appear before multiple committees when they may be being asked to do really important work.
Thank you, Steve. And I believe Raphael has taken that under consideration. And yes, if there's any way we can avoid duplication of witnesses, it would be beneficial to all, not just our committee, but all the other committees and to the witnesses themselves. Colleagues, seeing no more questions, and unless anyone else has any information
Mr.
or
Chair,
business. Yes, I do not see a hand raised, but who's speaking?
No, it's actually, it's me, it's the clerk, Mr. Chair.
Mr. Clerk, please.
I would just like some instruction from the committee regarding who we want to invite for Wednesday and Friday next week. According to the current work plan, we are to have representatives of Innovation Science and the Economic Development Canada, as well as the Office of Small and Medium Enterprises and the Procurement Ombudsman. We were originally planning that for Wednesday, and then the third meeting was going to be for next Friday. Can the committee give me some sort of instruction? Do they still want me to invite those organizations for Wednesday? And also, who would the committee like me to invite for next Friday? Because as we're not approving the work plan today, I would appreciate some guidance as to who I should invite to appear before the committee for the next meeting.
Paul, let me just intervene if I can as well. You're right, we haven't officially approved the work plan as presented by Raphael, but she is coming back with a revised work plan, hopefully early next week, based on the comments and suggestions from this committee. In the interim, my suggestion is that we, to the committee members, unless there's any great objections, we go forward with the next two meetings, at least certainly the next meeting on Wednesday, with the witnesses as suggested in Raphael's work plan. Unless I hear any significant objections to that, that would allow our clerk and analysts to start compiling the witnesses and confirming their attendance. I see one thumbs up from Madame Bloch. Thank you for that, Kelly.
Mr. Chair.
Mr. Clerk.
I hate to be unnecessarily bureaucratic or procedural. Unfortunately, the order we are currently working under requires that all decisions be taken by a recorded division. That is the order adopted by the House. If the committee will permit, may I put to them the question that you just enunciated, that we follow the work plan for the next two planned meetings in anticipation of a revised one being presented by the analysts in the near future?
Excellent. Please proceed, Paul.
I will proceed on that question. The first I will ask for Monsieur Drouin. I'm going to need you to unmute your microphone to vote, Mr. Drouin.
I'm in favor twice. I voted twice technically.
Mr. Joe Howry.
In favor.
Mr. Kuzmierczak.
Support.
Mr. McKinnon.
We.
Mr. Wheeler.
Mr. McKinnon, yes, I support this.
Mr. Abultiev.
Oh, sorry, Paul, I cannot hear you. I'm not sure if your microphone is muted or not.
I beg your pardon, Mr. Abultiev?
Yes.
Thank you. Ms. Bloch?
Yes.
Mr. McCauley?
Yes.
Madame Vignola?
Oui. In favor.
Just so that I'm clear, if we vote affirmative to this, then that's it. Nobody can be added to that.
No. If I can just repeat, the proposal is that we follow the current work plan for the next two planned meetings. But
I just know in the original statement, the chair had said we're going to do it for the next one. And then when you expanded on it, you said two.
So I apologize, but my understanding, and perhaps I misunderstood, my understanding is that the issue was to deal with the next two meetings, which is to say Wednesday and Friday of next week. That's what I understood from the chair, and I may be mistaken on that, but
that's fine. We'll deal with next week, and we'll see if we can get other folks in later on.
Are you in agreement, Mr. Green?
You know what? I'm gonna vote against it.
All right. That would be 9 in favor and 1 against, Mr. Chair.
Thank you, Mr. Clerk. Then we will proceed, Raphael, with the next two meetings as indicated on your work plan. But once again, colleagues, I would strongly suggest, should you have any additional witnesses or suggestions for evidence to be presented at this committee, get those in that information as quickly as possible through our clerk, so that when we make a revised work plan, it can take some of your suggestions into account. Colleagues, thank you very much. Once again, my apologies for the delay in commencement of this meeting. Hopefully it'll be a little easier next time, but we are adjourned.